Question number 1. CT scan was invented by. The right answer is option A. Godfrey Speed. Question number 2. Dye used for bronchography was. The right answer is option D. Dianocell. Question number 3. Enterochlesis is synonymous with. The right answer is option C. Small bowel edema. Question number 4. Ultrasound waves are produced by means of a crystal. The right answer is option B. Piezoelectric. Question number 5. NMR uses gyromagnetic property of. The right answer is option B. Proton. Question number 6. Increased density on X-ray film denotes. The right answer is option B. White shadow. Question number 7. The optimum distance used in radiographic exam is. The right answer is option A. 90 to 100 centimeter. Question number 8. Amongst the following phases of iodinated contrast medium enhancement, CT scan makes use of. The right answer is option D. Any of the above. Question number 9. Best investigation in acute cholecystitis is. The right answer is option B. Ultrasound. Question number 10. Micturating cystourethrogram is not used in. The right answer is option B. Hydronephrosis. Question number 11. Salt of barium used in barium studies is. The right answer is option B. Barium sulfate. Question number 12. Maximum radiation exposures is caused by. The right answer is option B. CT scan. Question number 13. The fields is used in MRI in clinical practice is Tesla. The right answer is option A. 0.15 to 1.5. Question number 14. For congenital CNS anomalies, the investigation of choice is. The right answer is option C. MR. Question number 15. The substance most widely used in medical ultrasound is zirconate titanate. The right answer is option D. Lead. Question number 16. Ultrasound is not useful in. The right answer is option C. Obese patient. Question number 17. Structures seen white on ultrasound image are. The right answer is option D. All. Question number 18. Zero radiography is mainly used for cancer. The right answer is option B. Breast. Question number 19. MRI should be used with caution in patients with. The right answer is option D. Cardiac pacemaker. Question number 20. Least resolution is observed in. The right answer is option A. Conventional X-ray. Question number 21. Scilography term is applied to X-ray demonstration by injection of a radiopaque media of which of the following? The right answer is option A. Limb scan. Question number 22. Pneumothorax is best demonstrated by taking a radiograph of the patient in. The right answer is option B. Expiration. Question number 23. Hydrated cyst of the lung in a chest X-ray. The right answer is option C. Will not calcify. Question number 24. Water lily appearance in chest X-ray is suggestive of. The right answer is option C. hydrated cyst. Question number 25. Popcorn calcification is seen in. The right answer is option A, pulmonary hematoma. Question number 26. Cause of homogeneous opacity on a chest X-ray is all except. The right answer is option D, emphysema. Question number 27. The most common cause of spontaneous pneumothorax is. The right answer is option B, ruptured subpleural blebs. Question number 28. Characteristic of benign lesion of lung in chest X-ray is. The right answer is option D, concentric dense calcification. Question number 29. Multiple translucent cysts on X-ray are found in the chest in all except. The right answer is option D, bilateral multiple cysts. Question number 30. Best method for bronchiectasis is. The right answer is option D, HRCT. Question number 31. Dye used for bronchography is. The right answer is option E, dianocell. Question number 32. Eggshell calcification is characteristically seen in. The right answer is option A, silicosis. Question number 33. Minimal pleural effusion is best detected by X-ray view. The right answer is option E, lateral decubitus with horizontal beam. Question number 34. Obliteration of left heart border in VA chest X-ray is suggestive of. The right answer is option A, lingular pathology. Question number 35. The imaging modality for breast in a patient of 20 years. The right answer is option B, ultrasound. Question number 36. The advantage of ultrasound. The right answer is option D, all of the above. Question number 37. Calcification in the heart wall is suggestive of. The right answer is option A, carcinoid syndrome. Question number 38. Following are the radiological changes in tetralogy of Fallot except. The right answer is option D, normal right arterial shadow. Question number 39. Isotope used in myocardial perfusion scan is. The right answer is option B, thallium. Question number 40. Left atrial hypertrophy is seen radiologically as. The right answer is option D, all of the above.